Our next presenter is from Bascom Palmer Eye Institute and is associate professor at the Miller School of Medicine at the University of Miami. And this is Dr. Raquel Goldhardt, and she is no stranger to communicating with patients that speak a different language, as she was born in Brazil. And so she has personal and after completing residency in Brazil, repeated her residency in the United States at Tulane, and then went on to do a retina fellowship at Bascom Palmer and a uveitis fellowship at UCLA. So she has firsthand knowledge of how difficult it can be to communicate with patients who speak a different first language than you. And so she's going to speak about the language barrier and communicating with patients that speak a different language. Thank you, Dr. Goldhardt.
Thank you. Thank you so much for the invitation as well. So he started with a nice introduction, and I would say, well, maybe I could start this talk and say, get a translator, right? And we are done with it. But just having a translator would not include. And that's what we want to do. So my question is, how are you doing? And like in your practice, like regarding the way you communicate with your patient. When communicating with them, are you making sure that he or she feel comfortable? The most important part of that interaction. And are you providing to your patient that sense of belonging and making him or her feel valued? Inclusion is what really matters, not just get a translator. So nowhere is diversity and inclusion more important than in healthcare. I think they are critical, not just to provide a high quality of care, but also education. And, but we have to be able to connect and communicate with the patients. So if we speak different languages, how can we achieve that goal? In 2014, the CMS Office of Minority Health has published an issue brief stating that overall 8% of 52 million Medicare beneficiaries across the country have limited English proficiency. And it was most prevalent in Asian Hispanic patients. Now, overwhelmingly, we know the most commonly spoken language outside English is still Spanish. But the number of non-native English speakers in the US now includes over 60 million people. It nearly tripled the number from just 3 decades ago. With nearly 1 in 5 Americans speaking another language at home, of course, medical professionals, not just physicians, are bound to come across those patients with whom they're going to have difficulty communicating with. So yes, employing a medical interpreter is vital for those situations, but like I said, it's not all that matters, and I'm going to talk about that. So one very important point about the patient engagement is a meaningful interaction. 3 strategies to achieve that is give the health data to the patient. Let them look at the numbers, let them look at the results, let them make their interpretation, and then you go over that. And the way you communicate with them. And look back at the patient satisfaction. Because sometimes you think you're communicating well, but they don't think so. So in healthcare, bridging the language barrier is necessary to avoid clinical errors, provide patient-centered care, and comply with legal and regulatory mandates. Communication, it can take multiple forms, but I would talk about the most basic sense. It's just the face-to-face. You have to first listen, don't interrupt. Sometimes it's difficult, we want to run, but especially with these patients is important. And remember to be empathetic. Be mindful of patients' preferences because they have different cultures and they bring a lot of other ideas that you're maybe not even used to. And look at your patient. You still need to make a personal connection. I know healthcare is like becoming saturated with technology, and many claim that's a good thing. But studies shows that patients respond better to you, to the provider, if you spend less time looking at the screen. So if you think you're frustrated trying to communicate with a non-English speaking patient, just imagine how scared and overwhelmed they must feel. So they're sick, sometimes just vulnerable, and surrounded by all these people jabbering a different language. Provide this environment that welcome people from all languages. It starts long before your interaction with them. It starts with the people on the phone, making appointments, prescription, follow-ups. If they call and they cannot get anything through, they don't know what's going on, they're not going to come back. So there's a few tips here, and one is learn a few polite expressions. You know the two languages that are commonly spoken here, so you can learn a few polite expressions. A simple good morning or a thank you in the patient's native language, I think will go a long way towards improving your relationship with them and also building trust so they will come back. Keep it simple. The shorter the explanation, the better. So aim for words and phrases that are simple to understand, easily translated. Long explanations can lead the interpreter to summarize your words in a way that maybe doesn't express fully what you're trying to say. At the same time, try not to patronize the patient, just not to try to decide for them. One good example, just about drops, simple drops. I love Sharpies. And maybe in Spanish you already know how to say a few things in Spanish, but maybe not in Chinese. So Sharpie is excellent. You can mark the bottom, mark the box. You can get a piece of paper. You can even communicate drawing something with your patient, but do the best you can. The tip number 3, look at the interpreter. If you have an interpreter there, it's not just look at the patient, but to the interpreter. It's very important to stay engaged while the interpreter is translating your words. Because if you look through the chart, just try to avoid talking to others in the room, look through the window because it's translated. Just you have to signal your interest by facing the interpreter. Patient will see that. You have to remember those things. Try to do that. Try to make a conscious note of that. And speak in full sentences. Yes, short, but full sentences, because you may think that it's helpful to stop mid-sentence, to allow the translator to catch up with what you're saying, but maybe doing that, you're going to put that information out of context and maybe even get an inaccurate oral translation. Now, the federal law requires linguistic services for patients with limited English proficiency. In addition, the healthcare organizations that receive federal funds must provide services in a language that a patient can understand. So if you don't know the language at all, you have to have a reliable source of interpreters. And you have to document the use of interpreters. So avoid the use of patient family members or friends if you can. And the interpreting encounters, they are going to take longer, but they will save time in the long run. And if you want to be a better doctor, do that. On-site interpreters, yes, are better, but they're costly. You can use a telephone, video conference. And at Bascom Palmer, we have a lot of Spanish speakers in Miami, and they love Google Translate. Be culturally sensitive. Become a culturally competent doctor. I would say, appreciate that. Just don't be appropriate. Appreciate, look at your patient. Remember all those things that I said and connect with them. You're going to be an even better doctor than you already are. Thank you.